pediatric COVID-19 on an outpatient basis. I presented the same topic at the physical conference, and I'm invited here to speak on pediatric COVID. Okay, now I need not be very elaborate of what COVID and what difficult times we have been through and how many lakhs and millions of people were killed all over the world. Okay, that was a time in which we had turned to all religions and we had turned to all religions and humanity and our next slide, please. Yeah, we had from the Notre Dame of Paris to all our Hindu gods, the Mecca. Everyone was in this thing. We had lots of deaths in every family, and children had become orphaned, parents and grandparents had died, and COVID had made us mad, and the world was almost like a brink of extinction. This is my clinic and my hospital where I'm practicing, and this is the place where we had actually done our studies. This is the International Journal of Contemporary Pediatrics. My article is an open article here where you can get the article. We have published the article in this journal. This is just my introduction. Now they call me as a doctor, a guide, and also a granddad, because after 20 years, parents have become grandparents. Now this was the background of COVID-19. Okay, and in 2019, we had been, since 2019 December, we had declared it as an epidemic. The SARS-CoV-2 rapidly spread, and it was the first pandemic of a 21st century. My study was a collective descriptive study with an analytical wing. 756 children over 2 years were studied, and our diagnosis was based on a COVID RT-PCR test. The treatment was done by nebulization, bronchodilators, antibiotics. The chi-square test and the SPSS software was used, and the proportions were less than 0.5. This was proving the significance of our study. The same thing in the theoretical form is over here. Only thing is what we have done is most important is these patients, since it was quarantine at that time, we had the patients on home quarantine, and we had done teleconsultation of all our 756 patients. Okay, so in the study of COVID affected patients, as we have already spoken, p-value was less than 0.05, which establishes the significance of our test. Okay, so since I'll go into the details of the protocol which I have used, and I firmly want people all over the world who are struggling with COVID as of now to use our mechanisms of treatment, so that there will be less patients who will be suffering all over the world. Okay, and this was done at my clinic. 756 children from birth to 18 years of age. Patients were on home quarantine and a video consultation and teleconsultation. We asked the parents used to record the daily temperature, the daily pulse oximetry, and to check basically the respiratory rate on the video, which is easily possible. Maybe after first 5 or 6 patients, it would be difficult. But then after 5 or 6 patients, we were comfortable with the patients being on teleconsultation. Either the sister or my residents or I used to do the teleconsultation. We used to, at least for first 5-6 days, we used to do the teleconsultation by ourselves. And it really used to pick things up. The RT-PCR test, the pathology person used to go and collect the RT-PCR swabs. And believe you me, when the RT-PCR swabs are collected, what they show on the television, and children are scared. See, children any which ways cry, and you just require a few micro drops of the virion. So when the child cries, there's no need to put the stick in the nose. You can just dab the stick at the nose entry, and you pick up the secretions there. And within 24 hours, we used to get the reports. The cough, cold, fever, only those patients we have done, since it was a collective analytical study. Only of the symptomatic patients we used to do the RT-PCR test. Now, this is the most important slide, and this is the most important protocols which we have given. The first and foremost thing which I always say is, in a patient with cough, cold, fevers which were there, we had immediately started the patients on nebulizations. There used to be pharmacological combinations of salbutamol and ipratropium, which we have used, and steroids as anti-inflammatory. The budesonide respules were used. With all the children were cough. The child and the parent had to purchase their own nebulization machine, and so each child had a separate nebulization machine for its use at home. A cough syrup containing salbutamol was started uniformly to all the children. Antihistaminics containing chlorpheniramine was given to all the children. Antibiotics, I will justify why we have used antibiotics in the end. The third generation cephalosporin like cefpodoxime, along with the lactobacillus preparation we used to give. And last but not the least, because all these children were having fever, so antipyretics like paracetamol or mefenamic acid. This was our standard protocol for all the patients who were following up and who were being treated, all the 756 patients on the teleconsultation basis. We followed from all the three waves, from the initial wave to the Delta wave and to the last Omicron wave, and in the three waves patients which we have included. Now, when I submitted the paper, it was a study of 756 patients, but then further on, it has almost gone to now 15,000 patients that I will be publishing the next paper. The three steps of RT-PCR test, which I have said over here, which we did not go into the details. Sample collection, as I've said, even a few microns of the particles of COVID, which is collected at the nose entry, is okay. You need not put a swab stick very much deep inside the nose. And once it is to be handled by the laboratory scientist, and then the PCR method, in which the heating and the cooling cycle amplifies the amount of genetic material. So basically, even a few micro drops of the cough, which or the snorts of the nose is okay. Within 24 hours, we used to get our results. So now, what are the take-home messages which I want you all to know? Out of the 756 children, we had no patient which was requiring a hospitalization. We had no patient who was having a multisystemic like MISC-like syndrome. All these patients were on home quarantine. The daily checkup of all of them was done by pulse oximetry. In some children, the fever went away by 2-3 days. Some others, it persisted for 4-5 days. And many people became asymptomatic at the end of 24 hours itself. Yet we completed a course of medicines from 5 to 10 days, depending on how much the child actually required. We have not used any oral steroids in our this thing. We have not used any antivirals in our this thing. And we have not used fancy drugs like remdesivir in our studies. Now, this is all black and white on paper. All our 756 patients recovered. I cannot say went home. They are already treated from home. None of my patients developed pneumonia. None of them MISCs, and no deaths. This is the same one in a pie graph form. None of the patients with pneumonia or MISCs. This is a bar graph representations. All of the 756 patients improved. This was how the symptomatology was. Fever definitely was one of the most important presentations of COVID. Fever with sore throat or respiratory distress with fever, fever with vomiting and loose motions, as with most of the infections. This was our age group which we had studied in our patients, of which 231 patients were in 5 to 10 age group, and 1 year and below was another common age group in which the patients were there. Male-female distribution was equal in both the age groups. Now, inhaled steroids, obviously we prefer inhaled steroids because the side effect of them in the oral form is definitely much more. Steroids being anti-inflammatory help in the prevention and the complications of the cytokine storm, which we were all worried about. So the cytokine storm, which we have prevented by using steroids right on day one. And if the patient is symptomatically better, we have definitely tapered off even the nebulizations very fast. And we also use the antibiotic cover. So therefore, this was one of the reasons why antibiotic cover was used, because we are using inhaled steroids. It was a pandemic situation, so we had no ways in which we can wait for 3-4 days and then we would start on antibiotics. So it was started on day one itself. Daily follow-up was of these patients was done on teleconsultation, so we were very comfortable with them and the child was very comfortable with us. And there was no progress to a pneumonia. That was our main worry, and therefore we have used antibiotics and the nebulization. And why cefpodoxime? Because in our area, in my area of practice in Mumbai, we had found good results over the past 20 years. Over the community-based infections were very much controlled with cefpodoxime. Okay, and we had no requirements for any biologicals, any antivirals or immune modulators. So we highly recommend the use of inhaled steroids, bronchodilators, pediatrics and antibiotics. Now, this is the most important thing. The first 5 days of viremia, I used to tell my patients, request my patients, order my patients, you get a cough, cold, fever, do not neglect your symptoms. Just call the doctor immediately. And within first 5 days of viremia, as with any other, just don't neglect it like it is just a mild thing, because then when it goes out of proportion, no one can do anything for you. So to prevent the early recovery and prevention and complications and the progression of the cytokine storm was definitely suppressed. These are all the CDC guidelines: hand washing, soap, distancing. Yes, definitely advisable, because it definitely would prevent a viral infection from spreading. This is my first and most important thing which I'm saying. Mild cough, cold, fevers, go to the doctor immediately. Therefore, we for the larger welfare of the pediatric population, I've extended and extrapolated my study to adult population as well. But that's a different talk, and it's a different study. As in France, as we have seen, you have barber shops where people are cutting their hair. We used to have these COVID collection centers where the nose sticks are put into the nose and the mouth, and the COVID samples are collected. In India, we used to have a lot of home remedies: black tea, green tea, herbal tea, kavas. We recommend all of them to soothe the throat. See, even our Indian sambars are good, but then something to soothe the throat definitely is always encouraged. Your hot steam is also encouraged, but in children, we were not about giving hot steam because it might cause burns in them. Back to the philosophy of life, because of COVID, we just came to know Mother Earth has been so kind to us. We could stay indoors in the quarantine with our near and dear ones, and we were all waiting for a vaccine to be taking place. I also say this, when gods like Salk and Sabine, they had introduced 100 years back, when they had introduced polio vaccines, they have saved so many lives from being crippled because of the polio vaccine. So a COVID vaccine was supposed to be a savior like that, but that was at the initial phases. We did not have a COVID vaccines, and as of now, also children less than 10 years, we are not very much into COVID vaccines. Like I say, Alexander Fleming was the father of antibiotics. He had no patent for penicillin. Similarly, I feel my study as well, if some child is benefiting in some corner of the world, I know so many Asian countries and European countries which are still struggling with COVID, just follow the protocol. I feel you should be happy you will be out of the infection fast. It was like a biological warfare. Where it came from, what it was politically induced, that I'll not go into this thing, but then the disease was like a disease of the untouchables, by the untouchables. It shouldn't have been. We were like, as doctors, we wanted humanity to be saved, and on the priority basis, we all were into quarantine. And at that time, I feel these are some quarantine puns just to ease the situation. Okay. my daily routine has changed. You just cannot roam around Oman. Kenya can wait indoors. On a lighter note, I always compare masks to undergarments. You shouldn't touch them. They are moist and sweaty. You are supposed to change them. They're protective. Husbands and wives locked in the same room with the child. God, maybe Corona was better. No, definitely not better. On one side, we have the Indian symbol of love, which is our Taj Mahal. The other side, we have our Eiffel Tower in Paris, which is a symbol of science and technology. And in between is the COVID virus and the COVID, what I say, their antigens, which catch the throat, injure the lungs, cause immune response. The death mortality of the COVID virus has been like World War I and II combined. We had COVID after 100 years of a flu in 1920. After almost 100 years, we had a second pandemic of another flu, that is COVID, which was destroying humanity. We have sailed through this. We should thank God. With this, I end my talk. If there are any questions, you can ask me. Thank you.